So, hello everyone, and welcome to Stethoscopes.eu first session. Today it's all about Littmann stethoscopes. So I'd like to introduce to you our presenter. It's Mr. Tiago Diaz, Osculation Channel Leader for 3M. He's going to talk to us about why you should choose a Littmann stethoscope and what features make all Littmann stethoscopes unique. As you already know, every registration counts as an entry for our big giveaway for two Classic III and Cardiology 4 stethoscopes. All winners will be notified via email after the end of this presentation. A recorded version of this webinar will be available in our YouTube channel, so please don't forget to subscribe because we will be organizing more events like this in the near future. Let's welcome our special guest, Tiago. You can start your presentation.
Hello. Okay. Let me see if I can start now. All right.
Okay.
So I think that you can all see my screen. Let me say hello, everybody. Thanks for joining our webinar, auscultation webinar. Special thanks for this invitation and for being here with Stethoscope.eu doing this first action, the first of many, I hope. Today the topic is how to choose and how to take care of your stethoscope, in this case a Littmann stethoscope. My name is Tiago Diaz and I'm the auscultation channel manager for the EMEA region, and I will be here with you this next 15 to 20 minutes to give you good information. The topics for today is all around this, what I have told. I would like just to make a small introduction about auscultation brand and Littmann, which stethoscope is the best for, in this case, for you as a professional, how to take care and how to choose and how to take care of your stethoscope, and what resources do you have that that can help you along, in this case, in the present and in the future. Our goal today is, of course, to give you the best tools and the best resources to support you at the highest level as a professional, of course, as a human being. Okay, so starting off, and just to give you a small introduction, we have to start, of course, from the beginning. Where did it start? I'm not going to give you a lot of information. You already know that. You already studied it for sure. So in the 19th century, in 1816, the person that invented auscultation, basically, or given this to us, is Mr. Laennec. He was the first one, the pioneer. I think there are three main points here: the beginning, the middle, when George Cameron invents the binaural, the first stethoscope that you can listen in both ears, and in this case, and after, with Dr. Littmann, that really revolutionizes auscultation with new features of the stethoscope that that brings you to the level of auscultation, basically, that we have here now. That started off with Dr. Littmann and 3M. Together and until now. We have more than 50 years of experience, always working side by side with healthcare professionals all over the world. We are a reference, and that's why, because we work with you and we try to give you the best solutions in quality, dedication, innovation, and of course, trust. So, talking about what matters, talking about Littmann, let's start with the beginning first, and it's might seem a little bit easier, this part, but it's a good start. It's a good way to start from the beginning, optimizing your performance. Don't forget the Littmann stethoscope. You can align your headset to your head, and you can do it strongly. Don't have any problem on opening the headset and adjusting to your head size. Use the right ear tip size. You have two sizes that you can use. So you have to adjust and use the right ear tip size that we have. Rotate to the correct size. Don't forget, you can rotate if you have pediatric and adult size. You can rotate it, hit the chest piece in order to choose what side are you listening and want to listen. And of course, this is a part also very important. Don't forget in the chest piece, the membrane, the pediatric membrane, works as a sound stopper. So remove sound obstructions from the outside. So you must have it well done, well put it in, and don't forget to check the seal. So if it's sealed, it means that you have the stethoscope working properly. Okay, just a few tips just to start. I know that you already know this, but always good to remember the good starting point for this. What makes the Littmann stethoscope so different and so special, and why do we give the best quality? It's because, first of all, the high acoustic sensitivity that we have with all our stethoscopes. Of course, and I'm going to show you along the type of stethoscope we have more or less sensitivity. It varies by model and the performance. The tunable diaphragms, as you know, this is very important, and this is basically a patent. This is technology that only Littmann stethoscopes have, and I will explain a little bit better on it. The snap tight soft sealing air tips. Our air tips are really comfortable, are really good. They really adjust to your ear in order to also to keep the noise from outside going in your auditive channel. So this is very important also for you to focus on what really matters, auscultation. The adjustable headset, as we have already seen. The next generation tubing. The tubings are very important, and we have worked year by year on improving on materials, improving on the best solution in terms of the tube, because part of the auscultation sensitivity comes from there. So we want to provide you the best tubes, and the precision of the chest piece. Of course, the design of the chest piece also influences a lot in terms of the hearing and the lightweight. Normally, Littmann stethoscopes, of course, are very light, so it's easier and comfortable to wear around your neck, and to have a light stethoscope. So, besides that, and coming back to the high and low frequency sounds, the tunable diaphragm. Repeat, this is really something unique. This is patented technology from 3M. So what you have here is the possibility, without moving your chest piece, to listen to low and high frequency sounds. So you can really focus it when you're doing a position and auscultation without moving it, and focusing on what you really should focus, that is the sound that is transmitting and the auscultation that you are doing. So if you put a little pressure in these low frequency sounds, if you apply a little bit more pressure, you have high frequency sounds. You don't need to be changing the chest piece from for high or low. You just need to focus and do this directly when you're doing patient auscultation. This is very simple. Seems something very easy, and it is, and it really helps when you're doing the auscultation. So this is one point more, and what distinguishes Littmann from other brands around the world. Which stethoscope is the best for, in this case for you, not for me? So we have a level of acoustic performance. We have a different set of stethoscopes that we can use. We go from the lightweight, more applied to nurses, then the pediatric range with the cardiology or the professional range, and of course the digital stethoscope. We have I think, a complete range of stethoscopes that you can choose, that you can have one or more, and that you can also upgrade depending on the needs that you have when you're doing your auscultation, when you're doing during your work. Don't forget also, each stethoscope has a different type of warranty. It starts with 2 years and goes to 7 years. So each type of stethoscope also gives you the comfort of the warranty when you buy a Littmann stethoscope. For us, what is important, of course, is you make the right
Tiago,
choice.
do you hear us? Tiago?
Yes.
Can you share your screen once again? Because some attendees have problems to see your screen. Please, from the bottom, answer and share your screen once again. Thank you very much.
Sorry for this.
No worries.
Let me see if we can share again.
Okay, just a sec. We are okay right now. You can minimize your Explorer and you can continue your presentation. Thank you very much.
If it's okay, I think we can continue already sharing.
We are okay. We are okay.
This is what happens in live streams. Everything can happen. So returning of what I was saying. So besides all the portfolio that we have, of course, we have the most ones that we focus. The first one, and normally the student stethoscope, is the Classic stethoscope, and we have the Classic range. It's a monitoring stethoscope. It's a very good stethoscope, dependable clinical tool for physical assessment, monitoring your patients. It's really good. And you can monitor and access a wide range of patients, detect normal and abnormal sounds and rhythms. It's useful on non-critical environments. This is very important to you to know, and has 5-year warranty. A perfect stethoscope to start, a perfect stethoscope for the student, and of course also for professional. But depending on what you want, what you need as a professional, of course, you can choose others. Don't forget these 5 topics with the Classic range, and in this case with the Classic 3, you have a tunable diaphragm. You have the pediatric side that is very helpful on doing and exploring the two situations, adult or pediatric. Single piece diaphragm, open bell, so you can still open it, the pediatric side, and use it as an open bell. The next generation tubing, and of course no natural rubber latex. Okay, all stethoscopes or 3M stethoscopes, they don't have natural rubber latex or pellets plasticizers. Okay, so it's really on using the right materials for this medical device. For the cardiology, so we here enter the professional range, what we call it, diagnostic stethoscope. So we really think that as a professional, you should have outstanding acoustics, sensitive to help you perform detailed diagnostic in auscultation. So if you want that, if you need that, you really need to change. If you don't have to a cardiology stethoscope, you can make diagnosis and make decisions with confidence, hear subtle change sounds in patient status. It's useful in critical care and challenging environments. So it's a really step up. You will see, and the first difference that you see also, it's in the tube. It's a double lumen tube, so you can hear 100% in both ears. And of course, you have more warranty, better quality, more warranty. You have 7-year warranty with this range, with the professional range, with the cardiology. Either it's the cardiology 4 or the master cardiology. Okay, so this is the 6. Sorry, the 7 points that that you have with this stethoscope: better audibility, single piece tunable diaphragm, pediatric side that covers to an open bell, like open bell, dual lumen tubing, what I was saying, so you can hear 100% in both ears. And this is next generation tubing also with 7-year warranty. So this is the stethoscope that is perfect for a professional, either is in the start of his career or in the middle or in the end. Of course, we have the electronic range, but this is the stethoscope that we really think that helps you as a professional. Okay. Besides that, two important things. Don't forget, depending on the use and the work and the environment and how you treat your stethoscope, you will need a long life of the stethoscope spare parts. The spare parts are available. For each stethoscope, you have a spare part kit that you can change, either the olives, either the membranes. So it's available for each type of stethoscope, and at some point you should be doing this. You should be doing this a year, 2 years, maybe 3, depending on how you're caring and taking care of the stethoscope. It all depends on how you clean, how you take care of it, and that we will see the best way, so you don't have to be changing a lot. Because at the end, what you want is to maintain the quality of auscultation, and only by doing the maintenance you will have it, or in this case, of course, purchasing a new one. So as for the warranty, we handle the warranty directly with our partners, and in this case with Stethoscope.eu, you can do it directly with them. What do we have to offer besides this? We talk about innovation, we talk about quality, but we also talk about service and other things that go beyond having just a medical device. So for that, what Littmann has been doing is give you access to a large range of colors and special finishes. At the end, we should be, while we're working happily, working with best tools and a medical device that really fits our personality, that really fits what we are. So that's why we've been developing new colors, special editions or special finishes, like the dark one, the black edition. Now we have the mirror edition, we have the rainbow, we have the high polish, we have a set of special editions, very interesting and very good for you. And don't forget, Stethoscope.eu also gives you different services. So you have 1 to 2 days in of fast delivery in all of UE and outside. You have the pouches to take care of the stethoscope and have more security. And also they do engraving, so you can also engrave your name, or if you're going to do an offer, the name of the person. This is features that are really interesting and really good when you're finding your new stethoscope. So taking this, let's go to another point. What resources do you have in this case to help you? Okay. First of all, if you are a medical, if you are a student, if you work in urgency, if UCI or general practitioner, whatever the type of job you are doing, you must find a suitable stethoscope for you, at least in the present, because you can upgrade, of course. Through Stethoscope.eu, you also can look and find the right stethoscope. From nursing to veterinary, critical, non-critical, pediatric, you have several things, and we help you choose the best stethoscope for the moment or for different situations. Because as a professional, you might find the need of having more than one different stethoscope. Education and training, also very good. We know that you are trained, you know that you had education, you know that you do this better than anyone every day, but you still need to review, or if you want, you have access to an excellent app of education and training. This is the Littmann Learning Institute app. It's an app that we also are upgrading constantly every year. Every stethoscope that you buy, you receive access to the premium content. So when you're buying it, you have in your chest piece the serial number, and when you're doing the registration on the app, use that serial number. You'll get access to this really good content, and in that you can do a lot of things. Okay, you have a lot of abnormal lung sounds or heart sounds, murmurs. You have all the sounds in this case that are studied. audio and visual integration. You can do a self-testing, so you can do also testing, especially for the students, or also to see if you still remember all your things that you learn about auscultation. And we do a refresher, okay, a refresher learning. So it's very interactive. It's on your phone, so it's always with you, and it's a really good learning app for auscultation. Okay, it's available on App Store or Google Play. So in this case, it's available almost for everybody. You just need a smartphone, and it's free with your stethoscope. Okay, so this is very interesting. I think this is very good also to have. As a professional, how can you take care of your stethoscope? So we give you a lot of points. These are the main ones. Okay, first one, of course, take care of the stethoscope. Don't leave it without cleaning or disinfecting for a lot of time. Ideally, we know that you should basically the membrane clean after every time that you do an auscultation to a different patient. Okay, at the end of the day, if you can, you should be cleaning also the tube, all your stethoscope, because this that I have around my neck is in contact with skin, is in contact with clothes, and is in contact with basically the environment. And we are talking about plasticizer. We're talking about material that, of course, along the time, depending on the care, will lose sensibility, will lose the properties that they have. So the first rule, and this is the most important rule, especially nowadays that we are living this unfortunately the pandemic situation, take care of the stethoscope and disinfect your stethoscope. For disinfection, I understand that you work with a lot of type of disinfectors, one with more alcohol, less alcohol, but for us and as the brand, you need to disinfect your stethoscope with 70% isopropyl alcohol solution. Okay, not more, not less. This is the recommended by us for a good cleaning of the stethoscope. Otherwise, you can start damage the tube, or you can start damage the spare parts of your stethoscope. So don't forget this. This is very important. And then the others, of course, don't submerge it to sterilization. Keep the stethoscope away from extreme temperatures, solvents, and oils. So, as I told you, if this is in contact with the skin, this is in contact with several things. Extreme temperatures, like for example, I can give you an idea. Don't forget your stethoscope on the car on a summer day. The tube will get thick, and will start to crack. So this is very important that you take care of it. We have all these recommendations also in our website or in Stethoscope.eu that they are upgrading and updating all the content just for you to have more information to follow. Okay. Stethoscope.eu is an authorized Littmann dealer. The Littmann stethoscope is probably the most counterfeit medical device in the whole world. So be careful. Don't buy suspect offers, very big offers, suspect very low prices. Be careful with marketplaces. Just look at this logo. Authorized distributor. This is the logo that Stethoscope.eu has. Sorry. And this is what gives us confidence to buy to an authorized Littmann dealer. Okay, and Stethoscope.eu has a great service, is working very well. It is a trustful dealer and is available in your country online in more than 100 languages. So it's definitely an excellent option for you to purchase your new stethoscope. Just wanted to give you the thanks for this opportunity. As it was told, this is recorded. Anything that you need, you can call directly or contact directly Stethoscope.eu. I just want to thank you to be a part of this project, and hope that all this information has been interesting and helpful for you. Okay. Have a rest of a good day and see you soon. Thank you very much.
Thank you very much, Tiago, for this very, very interesting presentation. I really hope we can do this again in the near future, covering other aspects as well of the Littmann stethoscopes.
Me too.
So,
thank you.
Okay, you are welcome. As I mentioned earlier, a recorded version of this webinar will be available in our YouTube channel, so please don't forget to subscribe for more events like this in the future. Thank you everybody for attending, and we will notify the winners for the 4 stethoscopes via email. Thank you very much and see you soon.